this is Dr. Michelle Robin, and I am teaching you some mechanical tips you can do to help your spinal hygiene. So many of us do dental hygiene, but we forget to take care of our spine. And what's our spine do, Maya?
Posture, everything.
Posture does everything, controls our nervous system, and which controls everything. Digestion, your neck issues, as well as back pain. So hey, I'm going to show you a couple tips. This one is called foam roller balance, and what we want to do is we want to turn on the deep spinal muscles. Depending on where your body's at in your back, you have 5 to 7 layers of muscles. So many times we work on the superficial ones, but we forget to work on the deep ones that control the spine. And the spine is like a chain, and it can get loosey-goosey. And what we want to do is we want to tighten that up. It'll help your posture, your digestion, your brain health, as well as your pain. All right, so here we go. I want you to lie on your back here. This is a 3-foot long, fairly firm foam roller. And what we're doing here with Maya is we're teaching her how to turn on her multifidi muscles. Yes, multifidi muscles. Those are the ones that support this spine. Those are the baby muscles. And most people, these are not turned on. And when not turned on, the rest of the body has to overwork, and that creates some muscle imbalances. So what I want you to do is go ahead and put your feet a little closer together where they're not touching. And all of a sudden, pull your feet, there you go. Now you have locked in those muscles in your back. Can you feel the difference?
Yes, I can.
Okay, and then ideally you're able to balance here for at least 1 minute. So what I want you to do now is, can you go to just your fingertips? And you can see how that changed a few things. You got a little wobbly there. It's crazy, isn't it?
Yes.
A lot of times students, you're in college and you sit a lot, and that will turn off these muscles. Plus, my young people, what I find, if they're when they're in their 15, 16, 17s, they start having hormonal changes, and that will also turn off this muscle. So this is really key, not just for my older patients and friends, but also for my younger ones. All right, so now you've gone to one finger. So can you put one hand on your belly without losing your balance? Okay, you're doing great. She's been practicing this, so good job. I'm going to encourage you. This looks a lot easier than it really is, right?
Yes.
Okay, can you put your right hand on your belly without falling off? Barely, but you're doing it. Okay, so go ahead and just stay with your right finger down. And so you would set a timer for 1 minute and hold this for 1 minute. Okay, and do that once or twice a day for the next couple weeks, and all of a sudden you'll activate the multifidi muscle, which will help your spine not degenerate. Wouldn't that be nice?
Yes.
Kind of like brushing and flossing. You're doing some spinal hygiene right now. Now, let's say you've mastered this. Okay, there's one other advanced step you can do. Go ahead and put your left hand down. But let's pretend that you've mastered it and you have both hands on your belly. I want you to do just a really gentle march. Just lift up your right foot about this much off the ground. See how that changes things?
Oh.
Now you're working the other muscles as well and really engaging them and turning them on. And now take that down and do the left side. Perfect. And now go back and forth like you're marching. And for those of you viewing, you can see how she's a little wobbly, and we're just turning on those muscles and engaging them. So many times in life, it's not the muscles that are hurting us that are the problem, it's the ones that aren't doing their job. So we're turning on her muscles so that she can have better spinal hygiene and help her low back. All right, try this. Once or twice a day, 1 minute, for the next couple weeks. It will change your life. I am pretty darn sure.